Well, good morning/afternoon/evening. One. Today, I want to talk about an important topic that has had a significant impact on women's health, society, and family planning over the past several decades. Birth control pills. These pills have revolutionized reproductive health, giving women more control over their bodies and their futures. However, while they are widely used, there are still many aspects of birth control pills that deserve closer examination. Whether it's launching a new ebook by informing women how to virtually squash their cubs by a slightly less corrupt way, or creating a much less endurable. In this speech, I'll cover what birth control pills are, how they work, their benefits, potential risks, and some of the ongoing debates surrounding their use. What are birth control pills? Birth control pills, also known as oral contraceptives, are a form of medication taken by mouth to prevent pregnancy. They usually contain hormones that regulate a woman's reproductive system. The two main types of birth control pills are combined oral contraceptives, which contain both estrogen and progestin-only pills. How do birth control pills work? Birth control pills primarily work by preventing ovulation, which means they stop the ovaries from releasing eggs. They also thicken cervical mucus, making it more difficult for sperm to enter the uterus. Additionally, they thin the lining of the uterus, which makes it harder for a fertilized egg to implant. Benefits of birth control pills. One of the most significant advantages of birth control pills is their ability to prevent pregnancy. However, they also offer several other health benefits, such as regulating menstrual cycles, reducing menstrual cramps, managing acne, and lowering the risk of certain types of cancers like ovarian and endometrial cancer. They can also be used to treat conditions like polycystic ovary syndrome, PCOS, and endometriosis. Risks and side effects. Despite their many benefits, birth control pills are not without risks. Common side effects can include nausea, weight gain, mood changes, and headaches. In rare cases, they can increase the risk of blood clots, stroke, or heart attacks, especially in women who smoke or have certain health conditions. It is essential to consult a healthcare provider to weigh the pros and cons and choose the right method for each individual. Controversies and debates. The use of birth control pills has sparked debates over the years, particularly regarding their role in empowering women, religious views, and access to contraceptives. In some places, there are political or cultural barriers to accessing birth control pills, which can have a profound impact on public health, changing attitudes over time. Over time, the perception of birth control pills has evolved. Initially met with skepticism, especially in conservative communities, today they are widely accepted as an essential aspect of reproductive health. Their availability has allowed women to pursue education and careers, delay marriage and childbirth, and enjoy greater autonomy over their lives. Access to birth control pills. Access to birth control is a fundamental issue. In many countries, including the United States, debates over the accessibility of birth control pills continue to dominate political discussions. Affordable and easily accessible contraceptives are essential for women's health and empowerment. It's crucial that individuals have the right to make decisions about their reproductive health without restrictions. The role of education. Education plays a crucial role in ensuring that individuals understand how birth control pills work, their benefits, and potential risks. Comprehensive sexual education can help break down misconceptions and provide individuals with the knowledge they need to make informed decisions about their reproductive health. The future of birth control pills. As science advances, the future of birth control pills looks promising. Researchers are exploring options that may offer even more effective, safer, and long-lasting forms of contraception. This includes the development of male birth control pills, which would help to spread the responsibility of contraception more equally between partners. In conclusion, birth control pills have made a profound impact on the way we think about reproduction, health, and personal choice. While they are not without risks, they provide significant benefits to those who choose to use them. It's essential for us to continue to support access to birth control and ensure that everyone has the information they need to make the best decisions for their health and their future. Definition of birth control pills. Birth control pills, also known as oral contraceptives or simply the pill, are a form of medication that women take daily to prevent pregnancy. These pills typically contain synthetic versions of the hormones estrogen and progestin, or sometimes only progestin, which work together to regulate a woman's reproductive system. The primary purpose of birth control pills is to prevent pregnancy, but they can also offer other health benefits and treat various medical conditions related to the female reproductive system. The pill comes in several different forms, including combination pills, which contain both estrogen and progestin, and progestin-only pills, often referred to as the mini pill. The combination pills are the most common form and work in multiple ways to prevent pregnancy, such as preventing the ovaries from releasing eggs, ovulation, thickening the cervical mucus to block sperm, and thinning the lining of the uterus, which reduces the chances of implantation of a fertilized egg. Birth control pills are typically prescribed by healthcare professionals and require a prescription. They must be taken at the same time every day to maintain their effectiveness. When used correctly, birth control pills are highly effective at preventing pregnancy, with a typical use failure rate of about 7% and perfect use failure rate of less than 1%. The pill has been available since the 1960s and remains one of the most widely used forms of contraception around the world due to its effectiveness, convenience, and additional health benefits. Practitioners of pill sale prices were also one of the most widely used. There are two main types of birth control pills: combination pills and progestin-only pills. Both types work to prevent pregnancy, but they use different mechanisms and may have distinct benefits and side effects. Let's take a closer look at each type. Combination pills. Combination pills contain two hormones, estrogen and progestin. These are synthetic forms of the natural hormones that a woman's body produces, and they work together to regulate the menstrual cycle and prevent pregnancy. There are several variations of combination pills, but all of them have the same basic function. How they work. Conservation of ovulation. The primary way combination pills prevent pregnancy is by stopping the ovaries from releasing eggs. If no egg is released, fertilization can't occur. Thickening of cervical mucus. The hormones in combination pills make the cervical mucus thicker, which helps block sperm from entering the uterus and reaching any eggs. Thinning the uterine lining. Combination pills also thin the lining of the uterus, which makes it harder for a fertilized egg to implant and grow. And regularizes periods, making them more predictable and lighter. Reduces menstrual cramps. Helps control acne and may reduce the risk of certain reproductive cancers like ovarian and endometrial cancer. Can reduce the risk of ovarian cysts and conditions like endometriosis. Types of combination pills. Monophasic pills. These pills have the same amount of estrogen and progestin in each active pill, simplifying the regimen. Biphasic pills. These pills provide two different doses of hormones at 2 points during the cycle. The goal is to more closely mimic a woman's natural hormone fluctuations. Triphasic pills. These pills offer 3 different hormone levels at different times during the cycle, providing even more variation in hormone dosage to mirror a woman's natural menstrual cycle. 2. Progestin-only pills, also known as the mini pill, contain only progestin, a synthetic form of the hormone progesterone, without any estrogen. These pills are a good option for women who cannot use estrogen due to health concerns, such as women who are breastfeeding, smokers over the age of 35, or those with certain medical conditions, like high blood pressure. How they work. Prevention of ovulation. Progestin-only pills may prevent ovulation, but they primarily work by thickening cervical mucus, which prevents sperm from reaching an egg. Thinning the uterine lining. Like combination pills, progestin-only pills also thin the lining of the uterus, making it less likely for a fertilized egg to implant. Benefits: suitable for women who cannot take estrogen, safe for use during breastfeeding, as they do not interfere with milk production. Can be used by women who experience side effects from estrogen-entainment pills. Challenges: progestin-only pills need to be taken at the same time every day, and they are less forgiving if a dose is missed. 3. Extended cycle. In addition to traditional combination and progestin-only pills, there are extended cycle pills that allow women to have fewer periods throughout the year. These pills are a variation of the combination pill, but they extend the hormone-free interval, meaning women have their period only once every 3 months or so, instead of monthly. Benefits: reduces the frequency of periods, which can be convenient for women who experience heavy periods or menstrual cramps. Some women prefer this method to reduce the monthly burden of menstruation. 4. Continuous birth control pills. Continuous birth control pills are similar to extended cycle pills, but are designed for women who do not want to have periods at all. These pills contain a steady dose of hormones that are taken without any hormone-free intervals. They contain 100 milligrams. How they work. These pills are taken every day without a break. There is no week of inactive pills, so the woman does not menstruate. Benefit: eliminates periods altogether, which can be beneficial for women with certain medical conditions like endometriosis or severe menstrual disorders. Can be used to reduce the occurrence of menstrual migraines. Summary of the main types. Combination pills contain both estrogen and progestin, prevent ovulation, thicken cervical mucus, and thin the uterine lining. Progestin-only pills contain only progestin, primarily work by thickening cervical mucus and thinning the uterine lining, ideal for women who cannot take estrogen. Extended cycle pills. A type of combination pill that allows fewer periods, typically once every 3 months. Continuous pills. A type of combination pill that eliminates periods entirely by taking active hormones every day without a break. Each type of pill offers different benefits, and the choice between them depends on a woman's health, preferences, and any underlying medical conditions. It's important to consult with a healthcare provider to determine the best option for each individual. Birth control pills are a highly effective form of contraception that prevent pregnancy through a combination of hormonal effects on the female reproductive system. Depending on the type of pill, birth control pills contain synthetic versions of 2 primary hormones, estrogen and progestin, or just progestin in the case of progestin-only pills. These hormones work in several ways to prevent pregnancy, and understanding these mechanisms is key to recognizing the effectiveness of birth control pills. 1. Prevention of ovulation. How it works. The primary function of most birth control pills, especially combined pills, which contain both estrogen and progestin, is to prevent ovulation, the process in which the ovaries release an egg. Why it matters. The hormonal effect. Estrogen and progestin in combination pills act on the hypothalamus and pituitary gland in the brain to signal the body to stop producing the natural hormones that trigger ovulation. As a result, the ovaries do not release eggs during the menstrual cycle. The thickening of cervical mucus. How it works. Another key way birth control pills prevent pregnancy is by altering the cervical mucus, which is produced by the cervix. Estrogen and progestin in combination pills, or just progestin in progestin-only pills, make the cervical mucus thicker. Why it matters. Thickened cervical mucus acts as a barrier to sperm. Sperm has a much harder time swimming through thick mucus to reach an egg in the fallopian tubes. This makes fertilization more difficult and helps prevent pregnancy. Progestin's role. In progestin-only pills, the progestin hormone is primarily responsible for this effect, making the mucus thick enough to prevent sperm from entering the uterus. 3. Thinning the uterine lining. How it works. Birth control pills also work by thinning the lining of the uterus, endometrium, making it less likely for a fertilized egg to implant if fertilization does occur. Why it matters. If an egg is fertilized by sperm and begins to travel toward the uterus, it needs a thick, nutrient-rich endometrial lining to implant and grow. By thinning this lining, birth control pills make it more difficult for a fertilized egg to properly attach to the uterus and develop. Hormonal influence. Both estrogen and progestin work together to reduce the thickness of the uterine lining, which decreases the chances of a successful implantation. This is another layer of protection against pregnancy. 4. Effect on menstrual cycles. How it works. Birth control pills also help regulate the menstrual cycle. The hormones in the pills regulate the timing of menstruation, often making periods more predictable and lighter. In some cases, birth control pills can make periods shorter or completely stop menstruation when continuous use is adopted. Why it matters. For women with irregular cycles, heavy menstrual bleeding or painful periods, birth control pills offer significant relief by regulating and lightening their periods. For women on extended cycle or continuous use pills, the ability to eliminate or space out periods can be beneficial for lifestyle or medical reasons. 5. Prevention of ectopic pregnancy. How it works. While birth control pills generally prevent pregnancy by stopping fertilization, they also reduce the risk of an ectopic pregnancy when a fertilized egg implants outside the uterus, typically in a fallopian tube. Why it matters. Since the pills thicken cervical mucus and change the environment of the fallopian tubes, they help prevent sperm from reaching the egg. In the rare case that an egg does get fertilized, the altered conditions in the fallopian tubes make it less likely for the fertilized egg to implant outside the uterus. 30 seconds. 6. Effect on ovulation and hormonal levels in progestin-only pills. How it works. In progestin-only pills, also known as the mini pill, the mechanism for preventing pregnancy is slightly different. While they still prevent pregnancy by thickening cervical mucus and thinning the uterine lining, progestin-only pills do not always prevent ovulation, especially if they are not taken at the same time every day. Why it matters. While progestin-only pills are still effective, they rely more heavily on the thickening of cervical mucus and changes to the uterine lining to prevent pregnancy, rather than inhibiting ovulation. This is why it's especially important to take the mini pill consistently, at the same time every day, to ensure maximum effectiveness. 7. Additional health benefits. How it works. Beyond preventing pregnancy, birth control pills can offer a range of additional health benefits due to the hormonal changes they cause in the body. These include regulating menstrual cycles. Birth control pills often help to regulate the menstrual cycle, making it more predictable and reducing heavy menstrual bleeding. Acne control. The hormonal effects of birth control can help reduce acne, especially for those whose acne is linked to hormonal fluctuations. Reduction in risk of certain cancers. Long-term use of birth control pills has been shown to reduce the risk of certain types of cancer, including ovarian, endometrial, and colorectal cancers. Management of conditions. Birth control pills are used to treat conditions like endometriosis, polycystic ovary syndrome (PCOS), and menstrual migraines by managing hormone levels and reducing symptoms related to these conditions. Summary of how birth control pills work. Prevention of ovulation. Stops the ovaries from releasing eggs, so fertilization cannot occur. Thickening of cervical mucus. Makes it more difficult for sperm to reach the egg. Thinning the uterine lining. Reduces the chances of a fertilized egg implanting in the uterus. Regulation of menstrual cycles. Makes periods more predictable and can reduce the intensity of menstrual symptoms. Prevention of ectopic pregnancy. Reduces the risk of fertilized eggs implanting outside the uterus. Health benefits. Helps regulate cycles, manage conditions like acne or endometriosis, and reduce the risk of certain cancers. In essence, birth control pills work through a combination of hormonal effects that create multiple barriers to pregnancy, making them an effective and versatile option for contraception and other health benefits. Benefits of birth control pills include the following. Birth control pills provide a wide range of benefits beyond just preventing pregnancy. Over the decades, they have proven to be a crucial tool in reproductive health, empowering women with more control over their bodies, their reproductive choices, and their overall well-being. These benefits are not only related to contraception, but also to managing menstrual health and addressing various medical conditions. Dr. Suzanne César. 1. How it works. The most well-known benefit of birth control pills is their effectiveness at preventing pregnancy. When used correctly, birth control pills are more than 99% effective. They provide reliable and convenient contraception, allowing women to plan and space their pregnancies according to their personal or family planning goals. Why it matters. This ability to control when or if to have children has a significant impact on women's health, economic stability, and overall quality of life. Women can pursue higher education, careers, and personal goals without the immediate concern of unintended pregnancies. 2. Regulation of menstrual cycles. How it works. Birth control pills help regulate the menstrual cycle by providing a consistent level of hormones throughout the month. This regulation makes periods more predictable and consistent, and many women experience lighter and shorter periods as a result. Why it matters. For women with irregular periods, this predictability is highly beneficial. It can also help women who experience heavy menstrual bleeding, making the process less uncomfortable and more manageable. 3. Reduction of menstrual cramps. 4. Or unfortunately inside you. How it works. Birth control pills can reduce the severity of menstrual cramps, also known as dysmenorrhea, by regulating hormones and thinning the uterine lining. This can make periods less painful and decrease the need for other pain relief treatments. Why it matters. 4. Management of acne. How it works. Some birth control pills, particularly those that contain both estrogen and progestin, can help manage acne. The hormones in the pills reduce the production of androgens, male hormones, which are responsible for the overproduction of sebum, a substance that can clog pores and cause acne. Why it matters. Acne can affect confidence, particularly in teenagers and young adults. By managing acne, birth control pills can help improve skin appearance and boost self-esteem alongside their contraceptive function. Children undergo an addition to exams diets. 5. Treatment of polycystic ovary syndrome, PCOS. How it works. Birth control pills are often used to manage the symptoms of polycystic ovary syndrome, PCOS, a common hormonal disorder that can lead to irregular periods, excess hair growth, and acne. The hormones in birth control pills help regulate menstrual cycles, reduce androgen levels, which control hair growth, and improve skin conditions. Why it matters. PCOS can be a source of frustration and emotional distress for women due to its visible and internal effects on the body. Birth control pills help to manage the symptoms, offering relief and improving quality of life. 6. Management of endometriosis. How it works. Birth control pills can help manage endometriosis, a condition in which tissue similar to the uterine lining grows outside the uterus, causing pain, heavy periods, and fertility issues. By regulating hormones, birth control pills help reduce the growth of this tissue, which can decrease pain and other symptoms. Why it matters. Endometriosis can be incredibly painful and often leads to infertility. Birth control pills offer a non-invasive treatment option that can help reduce symptoms and improve a woman's ability to manage the condition, especially in combination with other treatments. 7. Reduced risk of certain cancers. How it works. Long-term use of birth control pills has been shown to reduce the risk of certain types of cancer, particularly ovarian and endometrial cancers. The protective effect is likely due to the way the pills regulate hormones, reduce the number of ovulations, and reduce endometrial growth. Why it matters. Cancer prevention is a critical benefit of birth control pills, particularly for women who are at higher risk due to family history or other factors. Studies have shown that the protective effects can last for years after discontinuing the pills. 8. Protection against ovarian cysts. How it works. Birth control pills can prevent the formation of ovarian cysts, which are fluid-filled sacs that develop in the ovaries. By preventing ovulation, birth control pills reduce the likelihood of cysts forming. Why it matters. Ovarian cysts can be painful and may require surgical intervention. By preventing these cysts from developing, birth control pills reduce the risk of future complications and the need for medical procedures. 9. Improved bone health. How it works. Some research suggests that birth control pills may have a positive impact on bone health, particularly in younger women. Estrogen, which is a component in many birth control pills, helps maintain bone density, reducing the risk of osteoporosis later in life. Why it matters. Women are more prone to developing osteoporosis as they age, particularly after menopause. By improving bone health, birth control pills may help prevent future bone issues and fractures. 10. Convenience and control. How it works. Why it matters. This control allows women to plan their families, delay pregnancies, or choose not to have children at all. It gives women the flexibility to focus on their careers, education, and personal aspirations while making decisions about their reproductive futures. 11. Relief from premenstrual syndrome. How it works. Birth control pills may alleviate symptoms of premenstrual syndrome, PMS, such as mood swings, bloating, and irritability. The regulation of hormone levels through the pill prevents the hormonal fluctuations that contribute to these symptoms. Why it matters. For women who experience severe PMS, birth control pills can provide significant relief, improving emotional and physical well-being before and during menstruation. 12. Postpartum contraception. How it works. After childbirth, women who are breastfeeding may prefer to use progestin-only pills, the mini pill, as a safe, effective, and non-interfering contraceptive. Unlike combination pills, progestin-only pills do not affect milk production and are safe for nursing mothers. Why it matters. This option allows mothers to safely space out pregnancies without affecting their ability to breastfeed. It provides a convenient and effective method of contraception during the postpartum period. Summary of benefits. Prevention of pregnancy. Highly effective at preventing pregnancy, giving women control over family planning. Follow Asajed on the projector. Regulation of menstrual cycles. Helps women achieve more regular, lighter, and predictable periods. Reduction of menstrual cramps. Alleviates painful cramps, making periods more manageable. Kaizen parasitic egg. Management of acne. Helps reduce acne, particularly for women with hormone skin issues. Treatment of PCOS. Regulates menstrual cycles and reduces symptoms of polycystic ovary syndrome. Management of endometriosis. Helps reduce pain and manage symptoms of endometriosis. Reduced risk of cancers. Lowers the risk of ovarian and endometrial cancers. Protection against ovarian cysts. Prevents the formation of painful ovarian cysts. Improved bone health. May improve bone density and reduce the risk of osteoporosis. Convenience and control. Offers a convenient, user-controlled method of contraception with no ongoing visits required. Relief from PMS. Reduces symptoms of premenstrual syndrome, improving emotional and physical well-being. Postpartum contraception. Safe for breastfeeding mothers, allowing them to space pregnancies while continuing to nurse. In conclusion, birth control pills provide not just a method of contraception, but also a range of health benefits that improve quality of life, reduce medical risks, and empower women to make informed decisions about their reproductive health. Medical uses of birth control pills. While birth control pills are primarily known for their use in preventing pregnancy, they are also prescribed for a variety of medical conditions due to the hormonal regulation they offer. These pills have been found to be beneficial in treating several reproductive health issues, managing chronic conditions, and even alleviating some non-reproductive health problems. Let's look at the medical uses of birth control pills in more detail. 1. Treatment of polycystic ovary syndrome, PCOS. How it works. Polycystic ovary syndrome, PCOS, is a common hormonal disorder that affects many women of reproductive age, leading to irregular periods, acne, excess hair growth, hirsutism, and ovarian cysts. Birth control pills, particularly those that contain both estrogen and progestin, help regulate the menstrual cycle, reduce androgen levels, male hormones that cause excessive hair growth and acne, and prevent the formation of ovarian cysts. Why it matters. For women with PCOS, the hormonal regulation provided by birth control pills can significantly reduce symptoms and improve overall health. It helps restore menstrual regularity and can reduce acne and excessive hair growth, improving both physical appearance and quality of life. Yes, a bondidor authoritarianism. How it works. Endometriosis is a condition where tissue similar to the lining of the uterus grows outside the uterus, causing pain, heavy periods, and infertility. Birth control pills can help manage endometriosis by regulating hormone levels, which prevents the excessive growth of endometrial tissue. By reducing the menstrual cycle or eliminating it altogether, in continuous youth pills, birth control pills can lessen the pain and discomfort associated with the condition. Why it matters. Endometriosis can cause severe pelvic pain and may result in infertility. Birth control pills are an effective treatment option that can provide relief from pain, reduce inflammation, and help women manage the symptoms of this challenging condition, improving their quality of life. 3. Management of menstrual irregularities. How it works. Women with irregular menstrual cycles, such as those who experience cycles that are too long, too short, or completely absent, can benefit from the hormonal regulation that birth control pills provide. By delivering a consistent level of hormones, birth control pills help bring the cycle into a more predictable pattern, reducing the frequency and severity of menstrual irregularities. Why it matters. Irregular periods can cause stress, discomfort, and even difficulty in planning for family life. Birth control pills offer an easy way to regulate cycles, making periods more predictable and easier to manage, while also offering the convenience of being able to control the timing of menstruation. 7. How it works. Heavy menstrual bleeding, or menorrhagia, is a condition in which a woman experiences excessive or prolonged menstrual bleeding. Birth control pills are commonly prescribed to help manage menorrhagia by regulating hormone levels and reducing the thickness of the uterine lining. This leads to lighter periods, which can significantly reduce blood loss. Why it matters. Menorrhagia can lead to anemia, fatigue, and other health complications if left untreated. Birth control pills can be a vital treatment option, reducing bleeding and improving a woman's overall health by maintaining a more regular and controlled menstrual flow. 5. Treatment of premenstrual syndrome, premenstrual dysphoric disorder. PMDD. How it works. PMS is a collection of physical and emotional symptoms that occur before a woman's period, while PMDD is a more severe form of PMS that can significantly disrupt daily life. Birth control pills help by regulating hormone levels, which can prevent or reduce the severity of PMS and PMDD symptoms. Pills that contain both estrogen and progestin work to balance hormonal fluctuations, thus alleviating symptoms like mood swings, irritability, fatigue, and bloating. Why it matters. PMS and PMDD can severely impact a woman's mental health, relationships, and daily functioning. By regulating hormone levels, birth control pills can reduce these disruptive symptoms, allowing women to feel more balanced and in control of their emotions and physical well-being. 6. Acne treatment. How it works. Birth control pills, especially those containing both estrogen and progestin, are often prescribed to help treat hormonal acne. The hormones in birth control pills decrease the production of androgens, male hormones, which are known to increase oil production in the skin and contribute to acne breakouts. By reducing androgen levels, birth control pills can help prevent the clogging of pores and the formation of acne. Why it matters. Acne, particularly when hormonally triggered, can affect self-esteem and confidence. Birth control pills provide an effective way to treat acne by regulating the hormonal fluctuations that often lead to breakouts, especially in young adults and women with conditions like PCOS. 7. Management of ovarian cysts. How it works. Ovarian cysts are fluid-filled sacs that develop on the ovaries and can cause pain, irregular periods, and other symptoms. Birth control pills help prevent the formation of new cysts by inhibiting ovulation and regulating the hormones responsible for cyst development. Van der Pay cyst syndrome. Why it matters. Ovarian cysts can cause significant discomfort and, in some cases, may require surgical intervention. By preventing cyst formation, birth control pills offer a non-invasive way to reduce the risk of cysts and the complications they can cause, including pain and potential fertility issues. Yes. Reduction of risk of certain cancers. How it works. Long-term use of birth control pills has been shown to lower the risk of ovarian cancer and endometrial cancer. By preventing ovulation and reducing the amount of time the ovaries are exposed to certain hormones, birth control pills decrease the chances of these cancers developing. Additionally, the pill's ability to regulate the menstrual cycle and reduce abnormal cell growth in the endometrial lining further contributes to cancer prevention. Why it matters. Ovarian and endometrial cancers are significant health concerns. And birth control pills offer a preventive measure that can significantly lower a woman's risk of developing these cancers, especially if used over a period of several years. 9. How it works. Hormonal fluctuations are a common trigger for migraines, particularly in women. Birth control pills help by stabilizing hormone levels, which can reduce the frequency and severity of migraine attacks. Certain pills, especially those that contain both estrogen and progestin, have been found to be beneficial for women whose migraines are hormonally triggered, such as those that occur during menstruation or ovulation. Why it matters. Migraines can be debilitating, affecting daily activities and overall quality of life. Birth control pills offer an effective way to prevent hormone migraines, allowing women to experience fewer attacks and improve their ability to manage the condition. How it works. After childbirth, many women prefer to delay the return of fertility in order to space their pregnancies. Progestin-only pills. Many pills are commonly recommended as a safe option for postpartum contraception, as they do not affect breast milk production. These pills are safe for breastfeeding women and offer reliable contraception without interfering with lactation. Why it matters. Postpartum contraception is essential for women who wish to prevent pregnancy while breastfeeding. Birth control pills, particularly progestin-only pills, provide a convenient and safe option during this period, allowing women to have more control over their reproductive health without interrupting breastfeeding. Summary of medical uses. Treatment of polycystic ovary syndrome, PCOS. Regulates menstrual cycles and reduces symptoms like acne and excess hair growth. Management of endometriosis. Reduces pelvic pain and regulates hormone levels to alleviate endometrial tissue growth. Management of menstrual irregularities. Brings irregular cycles into a more predictable and manageable pattern. Treatment of heavy menstrual bleeding. Reduces excessive menstrual bleeding, lowering the risk of anemia. Treatment of PMS and PMDD. Alleviates emotional and physical symptoms of premenstrual syndrome and its more severe form, PMDD. Acne treatment. Helps manage hormonal acne by reducing the production of androgens. Management of ovarian cysts. Prevents the formation of ovarian cysts and reduces associated pain. Reduce the risk of certain cancers. Lowers the risk of ovarian and endometrial cancers with long-term use. Postpartum contraception. Provides a safe, non-interfering contraception option for breastfeeding women. In conclusion, birth control pills are an effective and versatile treatment for a variety of medical conditions beyond pregnancy prevention. They offer a convenient and well-established approach to managing reproductive health issues, improving overall well-being and reducing the risk of certain cancers and complications. Conclusion. Side effects. Nausea, weight gain, mood changes, headaches, and more serious risks like blood clots, stroke, or heart attacks in some women. Social impact. Birth control pills have empowered women to delay childbirth, pursue education and careers, and have greater autonomy. Education. Comprehensive education is critical to ensure individuals understand how birth control pills work, their benefits, and possible risks. Future prospects. Research into safer, more effective contraceptives, including male birth control pills, suggests continued progress in reproductive health. Birth control pills have made a profound impact on the way we think about reproduction, health, and personal choice. While they are not without risks, they provide significant benefits to those who choose to use them. It's essential for us to continue to support access to birth control and ensure that everyone has the information they need to make the best decisions for their health and their future. Thank you.